inflation, but they're also facing medical debt. And as we have all seen with the medical debt report, medical payment plan that was issued by HFS under the governor's office, we know that the majority of those individuals that got their medical debt forgiven are very low income, and also how much of a strain that was on their lives. So we're here to just highlight this one story. I won't get into all the other details, but we feel very strongly that it's important to address these issues because, again, individuals do not know when they go to the hospital emergency room who's treating them. They just want to be medically taken care of.
Thank you.
If I may very briefly, thank you so much. Megan Carter, I'm an attorney at Legal Counsel for Health Justice. I submitted written testimony. Just very briefly, I want to flag that HUPTA and Fair Patient Billing Act are great laws, but the hospitals have driven a truck through them by allowing these outsourced care arrangements. Of course, a private business can regulate a private business. They wouldn't let anyone in off the street. They have contracts with these entities. We need to get the Illinois benefit of the deal that they've struck. They get huge tax write-offs. They don't pay taxes, nonprofit hospitals, and they are outsourcing the care with entities. And consumers need to get the benefit of that arrangement.
Thank you.
I think there's a lot of misinformation. That statement, hospitals are paying over $3 billion in taxes to fund the Medicaid program in this state. And the reality is that HUPTA is a great law. But again, if you want to put different groups under HUPTA, put different groups under HUPTA, but don't allow hospitals, and the reason the hospitals don't own the physicians is they're underpaid. Medicaid underpays, Medicare underpays. The hospitals have to hire these specialists, but these specialists come from private equity businesses that have billions of dollars. If you want to put them under HUPTA, there's a way to put them under HUPTA without putting the hospitals in the middle of it. Thank you.
I like that idea. Do we have any questions? Minority spokeswoman Haas, please.
Thank you, Madam Chair. Hospitals are already mandated to treat anyone who comes into their emergency departments. They can't deny any protection or benefit for those individuals who walk through those ED doors. So this legislation includes, well, I guess I'll back up a little bit. They already have to provide those services when they come into the emergency department, regardless of an individual's ability to pay, their insurance, exactly. Whether they're a citizen, their immigration status, anything of that effect. So this legislation includes persons regardless of their citizenship or immigration status, expanding that coverage for them, the way I'm reading this. So what protection or benefits for that population are we expanding?
Who would like to answer?
I can, Madam Chair. We're not necessarily expanding services for a specific population. Under HUPTA, it's for anyone that is low income and uninsured. What we're simply saying is that citizenship status should not be one of the factors when somebody is applying. But we're not necessarily expanding for one group or another.
We're expanding, though, those entities that are not hospital employees. So we are expanding some benefits and coverage. And we are expanding a population of non-citizens.
What we're proposing is that if a doctor is providing services within a hospital site, those services should be covered under the hospital's financial assistance policy.
So we are expanding benefits and coverage to non-citizens.
With all due respect, we're proposing to anyone that's low income and uninsured. I mean, this issue has come up from different organizations, including others that are non-immigrant serving. Many providers that submitted witness slips.
I'm not likely to get a yes or no answer to that question from what it sounds like. If there's anyone else that might like to respond to that, I would appreciate that. But I'm sorry.
Yeah, the prohibition to ask about citizenship in this bill is a problem too, because the citizen might be eligible for Medicaid. You know, you might be able to get them the insurance they need, so that's an additional issue that we need to work through with the sponsor.
Sure. My last question is whose initiative is this? Who's asking for this change to happen?
In addition to ICR and Legal Counsel for Health Justice, we also have many organizations, including the ones that submitted witness slips, that have been bringing this issue to our attention. I'm happy to mention some of them, but I also want to be respectful of time, so you could let me know if I should name them or not.
Do you want us to read some of the witness slips Representative Haas?
I'm primarily concerned in who is it that's asking for this change, and whose initiative is this? I don't think that everyone filling out witness slips, it looks like we have 153 proponents. I don't think 153 people have probably reached out and said, I would like this piece of legislation changed. Someone came to the sponsor and asked for this to happen.
Mm-hmm.
Who is that that's asking for this to change? Is
Yes.
it ICR?
Both of our organizations.
So ICR and,
Legal Counsel for Health Justice.
thank you.
Any other questions? Representative Lilly.
Thank you, Leader Dagmar, for bringing the conversation forward. When you're looking at amendments, what are you looking to change?
So part of we're still actively negotiating this bill. I think that we are very aware of the issue that IHA has brought up to us, their main problem being that one private business cannot regulate another private business. That is something that we're looking to negotiate. How far we're going to get into the negotiation of that particular issue, I cannot guarantee that we're going to come back with something that's agreed upon. But what I will say is that a lot of the negotiation has also been on things that we can agree on. I think that everybody can agree that if somebody's applying for charity care, that somebody cannot go from one hospital to another and have a different application, right? I think so part of what we want to do in this bill is also include a standardized form for when somebody wants to apply for any sort of financial assistance, specifically talking about charity care as well. Another issue that we've been talking about has been issues with regards to the negotiating about whether or not we can actually expand the federal poverty guideline income eligibility from 200 to 300%. I think that one's extremely important. Removing the asset test, I go back to, we do have a lot of families who are asset rich and cash poor. And we should not be forcing families to sell their homes because they are between that or being sent to collections because of an emergency room bill. So I think those conversations that are actively ongoing as we speak.
Thank
So-
you.
You got another question? I'm
No,
sorry.
I look forward to seeing the amendment.
Anyone else? I'm told that we should move it along. Representative Avalar, what is your intention? You want to,
My intent is to continue to work on the bill. I am committed in continuing negotiations and bringing an amendment forward to the committee. Whether that amendment will remove opposition, that I cannot guarantee, but what I can guarantee is I'm going to work very hard to make sure that the concerns are being addressed.
thank you. Anybody else? All right. Clerk, will you please continue the roll call?
Manley,
Yes.
Syed, Haas, Avalar, Crawford, Laha, Lilly, Ma, Morris, Senalitro, Schmidt, Cochran, and Shahira said yes.
There being 8 votes in favor, 4 votes opposed, and 0 voting present, House Bill 5390 is declared passed and will be favorably reported to the House floor. Now, oh no, we're not done. That's why they're telling me to, I'm gonna have to get a little bit pushy here. I've allowed a lot of testimony and a lot of ongoing things, so we're going to, is Representative Canty, you are here. House Bill 5295, please step up to the table. And I'd like to also ask the clerk to add Representative Grassi to the roll. Whenever you're ready, Representative.
Thank you so much, Madam Chairwoman, members of the committee. I know that we are running a little bit long, and so I would like to keep this short because it will surprise you to learn that this bill is actually going to get an amendment. And so what I would like to do tonight is move this bill out of committee with my commitment to you that I will hold it on second and bring that amendment back when it is ready.
Will the amendment what will the amendment do to the opponents?
That is so great. We are pretty sure that it is going to move them into a not opposed position.
Well, I have 263 opponents.
You know what? I mean, a lot of people have a lot of feelings. Listen, I'm going to do my best. I'm going to do my best.
And 19 proponents.
That's
Do
right.
I have leave to not read all of these? Please. Thank you.
Thank you.
So, in all seriousness, Representative.
Yes.
Do you think that your amendment is going to remove all opposition?
I do not know that it will remove all 238. I think those are a lot of individuals with very strongly held belief. But
263.
yes, that's a lot of human beings, right? But what I can tell you is that there are some organizations that have raised some questions, and we are working through those.
Would you like to continue? Explain the bill.
Yes. So what this will do at kind of a high level is make it so that if you are receiving reproductive care, that information can be segregated from your electronic medical records.
Anybody have any questions?
Reminder, there will be an amendment.
I have a question.
Please.
Why would you want to do that? Why would we want to do this? What's a good example of that?
Yeah, so there are some states where it is not possible or not safe to receive reproductive health care, and we want to make sure that if folks are receiving that care here in the state of Illinois, they are not penalized for it later. And most of the risks associated with receipt of that type of care would also present as a miscarriage if something, though rare and unlikely, were to occur.
Representative Haas.
So if I'm understanding right, this is it's related to abortion care, correct?
Reproductive care, yes.
Well, we're going to call it two different things
Okay.
then, because that's how I'm reading it. And is that the only piece of health care that is felt that needs to be redacted from a person's health record?
So we have received concerns from people that would like us to expand this to other types of care, and we are working through concerns with the possibility and feasibility of that.
What might be some of those other health conditions that would need to be pulled from an individual's record, and why?
Lawful health care, for any number of reasons for safety to the patient.
Expand on that.
I mean, people seek medical care for all kinds of different reasons, and that care can sometimes be used against them later.
I need, I guess, a little bit more explanation to help me understand, so
I
that
think
we're on the
what's-
same page.
No, I think that's fair. What I can tell you is that in the amendment, which will come back, we will have the full scope of healthcare that will be covered by this segregation of data, and it will be implementable.
And an explanation as to why these specific healthcare conditions need to be segregated.
Yes,
And it will be coming back to committee.
yes.
And to clarify, this is an initiative of the governor's office.
Indeed.
Thank you.
No other questions? All right. Seeing no further debate, Representative Ma moves that House Bill 5295 do pass. Is there leave? Partisan leave? There being 8 votes in favor, 4 votes opposed, and 0 voting present, House Bill 5295 is declared passed and will be favorably reported to the House floor. We look forward to the amendment, Representative. I'm sorry, we're going to stand at ease for a moment. I'm sorry, I made a mistake. There being 9 votes in favor, 4 votes opposed, and 0 voting present, House Bill 5295 is declared passed and will be favorably reported to the House floor.
Thank you.
No cats, Ayes. Yeah. Okay, I'd like to invite Representative Briel to the table, 4233, House Bill 4233, whenever you're ready. Does she have amendments? That's already been filed.
Thank you, Madam Chair and committee.
Are you going to adopt an amendment?
I would love to
Okay.
adopt the amendment, please.
Okay. Representative Ma moves that the committee do adopt Committee Amendments 1 to House Bill 4233. All those in favor say aye, opposed say nay. In the opinion of the chair, the ayes have it, and the amendment is adopted. Please continue.
Thank you. HB 4233 amends the Hospital Licensing Act and University of Illinois Hospital Act to limit the scope of how healthcare kiosks can be used within emergency departments. It amends the act by prohibiting the use of, the amendment prohibits the use of machines that take vitals and then take those vitals and send them back to triage. So what happens is, if you have all probably been to a pharmacy, and you know how they've got those machines where you can sit down and stick your arm in and it'll take your blood pressure and your pulse and everything. What better way when you're strapped for healthcare providers and you have difficulties with staffing and even keeping locations open, than to be able to have an automated system. So currently kiosks are used. They're used to register your patient information. You can put in your list of symptoms and issues, your diagnostics, your history, and that's perfectly acceptable. What we're saying, and many, many nursing organizations are also saying, is that by allowing to have that next step, which is blood pressure, temperature, pulse, oxygen, and then that information being sent to triage, you're creating a risk for patients, and it's something that is not advantageous. So if you're in an emergency room, you should see a professional. It can help alleviate the backlog when the emergency rooms are busy to be able to fill out the information, but what it does is it prevents machines from taking vital statistics when there's another human being in the room that can do it.
Thank you. Anybody have any questions? I'm going to read the witness slips briefly, and this is on the amendment. There's 5 proponents. ACLU, Chicago Chapter, National Black Nurses Association, National Nurses Organization Committee, Illinois National Nurses United, Disability Housing Justice, and the National Nurses Organization Committee, Illinois National Nurses. And 1 with no position, Illinois Health and Hospital Association, Dave Gross. So no opponents to the bill.
Correct.
Questions? No questions? Okay. There you go, Representative Haas.
Thank you, Madam Chair.
You're welcome.
How many hospitals are utilizing kiosks of this type?
There are many hospitals that utilize ER kiosks. One of the considerations that the Hospital Association brought forth was to consider expanding it to include education components, which we just saw a bill about education, right, for patients who are diagnosed with conditions and sharing that information. The kiosks, I know down by us, you can sign in, you put all your information in, what your laments are, and then that gets sent back to triage. The difference is instead of having to sit in front of a person, which can help in those situations. So I am so sorry. Specific question you.
How many hospitals are using
Oh,
these types of
many,
kiosks?
many, especially in rural areas. And within the CO2 region, it's been implemented and rolled out throughout the CO2 region. So, however, they are not utilizing the technology yet to take care of the vitals, et cetera. But it is there, and it can proliferate, so.
Do you have a more accurate answer?
Yeah, I just appreciate the representative bringing the amendment forward. So right now under federal law, we cannot use a kiosk for clinical services. That's prohibited under federal law. So her amendment addresses that by excluding the clinical services. She's going to, the amendment now allows the kiosk to be used for administrative purposes. We would like to expand that to also educational purposes. So yeah, I think in terms of the workforce shortage in rural Illinois, I think we're all keenly aware of that, and technology obviously has a place for that. But again, in terms of clarifying the record, hospitals cannot use a kiosk for clinical services.
Could you say your name for the record, too?
I'm sorry, Chairwoman. David Gross with the Illinois Health and
Thank
Hospital
you.
Association.
So right now, they're only being used in emergency departments? Or in other-
Kiosks?
The kiosks.
They're also being used throughout hospitals. I know in our area, you come in for an appointment. Someone who just recently underwent a mammogram came in. She signed in on the kiosk. It had to put all of her vital information in for her appointment. Then it popped up on the screen how to get where she needed to go, and it was all very short. She's like, I wish I knew. I should have taken a picture of it so I could have figured out how to get where I needed to go. But yeah, they're everywhere.
And the only information it's accepting at this point is just the demographic information, nothing clinical.
No, there's clinical information on those kiosks. So if you have, say, a mammogram, that information of what room, who's doing the radiology, what the appointment is, all of that information is right there on the screen, as well as directions to get you to the location that you need to go to.
Okay,
I think
when
the
I'm
form we
talking
all fill
about,
out, I think the form we all
Right.
fill out when we go see a hospital or a doctor.
so when I'm talking about
Right.
clinical, I'm
Right.
thinking of things like answering questions about symptomatology, things of that nature, patient history.
That's all acceptable to put on the
Is
kiosk.
that on a kiosk now?
Yes.
Will this bill prohibit that?
No.
How are we
I
ensuring
think she's
HIPAA and private safety?
I think the original bill
patient safety?
anticipated it eventually being used for clinical services, and we've set the record straight here today that that's not allowed under federal law. But it looked like the original bill was anticipating the use of kiosks for clinical services. And now it's going to be used for administrative purposes, and if the representative's open to further amendments to include also educational, patient education information as well.
So that's, the security piece is already there, is what you're saying, for the
Yes.
information that's being put in? How are
I'm
we?
going to check back on, you're
Please
asking.
do.
You're asking in terms of the whatever information that you're filling out, where that is. I'll get back
Yes.
to you on that.
Yes,
spokesperson.
thank you, I'd appreciate that.
Yeah.
How are we addressing different patients of different age and disability and special needs that might potentially be utilizing these kiosks?
I wish I had an answer for you. They're just a regular kiosk. So if you, but there still is the available human. They have not removed the patient advocate when you come in the ER who says, oh, what's your name? Do you have your insurance card? And sees if you're bleeding profusely, et cetera. Right? We don't take those away.
Sure.
This is being able to be used in place. Well, we haven't taken it away yet. So.
Yet.
Yeah.
That's what I'm concerned about, and certainly when someone's being triaged, if they're bleeding out, obviously I'm going to assume, although I know I shouldn't, that they're going to be addressed immediately. So, yeah, I would like to know a little bit more about
Absolutely.
those special populations and special needs
Yeah,
folks.
it's a great question, and really, this had not come on any of our radar screens until this legislation. The kiosks were an issue. So happy to
Sure.
pull some of our members and get some information back to you.
Particularly with our discussion that we had earlier about, folks that are autistic that are going in for treatment.
I'm
that
autistic.
Might need to
Yeah, in
utilize
case anybody wondered.
a piece of equipment that they may not be comfortable using.
Or an elderly person, or a
Sure.
person who has, like I said, my constituent called me and was like, it was really confusing. It popped up on the screen. She's in her 60s. She's like, if I would have known that that's what was going to happen, I would have taken a picture of it. But there wasn't any notification of that.
Confusing
So
and
she was
scary
trying,
anyway,
yeah.
yeah.
And here she is, a woman in her 60s, very accomplished. And so, yeah.
And very young.
Okay. So we have these kiosks in place. We're using them now. How does this bill change how we're using them?
It just, in case the federal law changes, it prohibits the ability to utilize the technological capacity of kiosks, such as blood pressure, heart, pulse ox, temperature, that normally are done by a triage that machines are capable of doing.
So it prohibits any type of that clinical
And which is
piece.
already, as he
Okay.
said, federally, but
Well, thank you for
it
that.
also does that. And then it's for information only, which can be a help in cases where you have ERs. We have some ERs that are in the southern part of the state that are packed. And you have two patient representative advocates there, and people wait forever just to see someone. So, I'm not sure how they work the prioritization with all that. That's not my thing. I just don't want machines, when there are humans trained and capable there, to be able to make assessments of our human condition.
I neglected to, this might be of interest, I neglected to read the opponents on the underlying bill. Jordan Ryan from the Illinois Chamber and Jamie F. Please continue.
So I respectfully ask for an aye vote.
One other point of
Go
clarification.
right ahead.
Sorry, Madam Chair. Is there an amendment coming back to this committee?
No, the amendment's already here, and that was what took out the capability of utilizing the monitoring or any diagnostics.
In the future?
Yeah, that cut out of that
Okay,
part. Yeah.
thank you.
When you say monitoring and diagnostics, is that the clinical?
Yeah, the when you come in, the assessment.
But that's not what you were talking about, right, Dave?
Correct. But based on what we're hearing today, I think we need to get some information to the entire committee on how kiosks are being used in our hospitals and what purposes they are. This is sort of new. This is the first time this has ever been brought to IHA's attention, that there's an issue with the use of kiosks and the technology that brings, and the ability that it can be used in terms of dealing with some of the workforce shortages that we've seen in downstate. So I think with the spokesperson's questions and the sponsors' questions, we can respond to the committee in terms of what we're going to be allowed to use the kiosks for under this bill, and what we may not any longer be able to use. And that's why I say it would be nice if we could include
The education
an
component,
education
yeah.
component in this bill.
So are you, as a sponsor, willing to work with and to include the educational component, maybe discuss it, bring back another amendment?
Well, we've already talked about the educational component. We just briefly talked about it. They've said that they're going to send me over all the information related to it, so we can have a discussion about it.
So you'd like
It
to,
may or may not. I don't know exactly with the parameters and what the education component would include, so I can't say for sure.
hang on one second.
I'll work with you. I can't guarantee we're going to agree, but I'll work with you.
I was just inches from a clean getaway here. Lily, Representative Lilly.
Just while we're waiting, your information, Mr. Gross, will help us understand what the kiosk does,
Right.
which would help us make a better decision on what we're doing with this legislation. Is
Right,
that
how
what you're
that
saying?
technology is being used in our hospitals, I think that's a fair question by the committee, is what I've heard today, yeah. But it is not being used for clinical purposes, right?
Oh, right, well, that's what you said.
Yep.
Okay, thank you.
I haven't seen you all day. Go right ahead, Representative Grassi.
Thank you. I have a question. Who owns these kiosks? Are they owned by the hospital? Are they owned by another business that the hospital pays? I'm curious how these kiosks get into the hospital and who owns them and who benefits financially from them, if anyone.
You know, I have wondered that myself, have not been able to dig through the mounds of contracts yet to figure it out, but I know some healthcare companies have created their own software and AI tools that they then not only utilize in their own systems, but also then turn around and sell. But I don't know, but I'd be happy to look into that. That sounds like a fun deep dive. I'm a nerd, sorry. I like to know.
Yeah, we can poll some of our members and find out whether they lease it or whether they purchase it, yeah.
So I need to know what the intention is. So we're going to vote on the bill as amended. You're going to hold it and continue to work to get information to the committee, one being who owns the kiosks, but also then some information that just has come out and to work on the education component. Am I understanding?
We will continue to talk. I'm making no guarantees that the educational component will be agreed upon by the two of us. However, I would love to dig more and get more information into like how kiosks are used, who pays for them, where the money goes, the entire 9 yards. So, but I will make all the effort. I have a full confident in my word is very true. I mean, you know, I kind of can't lie very good. So we'll work together, and I'm happy to work on that. But I'm not going to promise that there would be an amendment. What we have right now is which federally we know is not legal, is to prevent kiosks in case something happens from doing diagnostics. And that's the essential point of this at this point.
So that I'm clear, you're going to continue, your commitment is to continue to work on it, hopefully, but not guaranteeing that you'll have another amendment.
Correct. And it could be an amendment next year as we do more investigations and learn more about kiosks. I think it's really important that we get this on the radar now and start to look at the parameters and get something which is a quick stopgap to make sure that nobody ends up being able to utilize that, which while there are laws, not always laws are clear. Sometimes they get interpreted, and this is a way that I think we can work together. So is that, I mean, yeah.
Yeah, we've got you on record and your intentions, and I appreciate that. Is there any other questions? No other questions? Did you see something? All right. Nobody move. There being no further debate, Representative Syed moves that House Bill 4701, oops, wrong one, moves that, take your time, We did. Look at this. Reps, okay, here we go again. There being no further debate, Rep. Syed moves that House Bill 4233 do pass as amended. Is there leave? Yes. Hooray. There is leave on a vote of 13 in favor, 0 opposed, 0 voting present. House Bill 42, what's the bill number again? 4233 is declared passed and will be favorably reported to the House floor as amended. We have one left. I appreciate you guys all hanging in there. Representative Katzmull, you have permission to present from your chair, or if you want to go up front, whatever you want to do. All right, all right. Chair recognizes Representative Katzmull to present House Bill 4701. Brevity is appreciated.
Thank you, Chair. I will indeed be brief. This bill is to regulate facilities fees. I think, like most of you, we've had constituent calls regarding surprises on their bills, people who were at a doctor's office or an urgent care suddenly seeing a line item more like they would have expected had they gone into the ER or for an inpatient kind of treatment. This bill would help us create guidelines around that were site-specific and service-specific, so that we don't have situations, for instance, like the constituent case that brought this to my attention, where somebody came into a doctor's office, was told they might have walking pneumonia, to please just step across the hall to have an x-ray, and suddenly received a bill that was 3 times what they would have because they had crossed an invisible line. We've done a really good job educating patients to try and not visit the ER, but we've got a lot of uncertainty still out there about what happens if you go to a building that is nearby the hospital, or a building that is similarly named but not at the hospital campus, or the urgent care that is semi-connected. And so this bill is about trying to find a way to have consistency and transparency, more so than the bill last year that would just have told that patient sort of on the spot, this is your situation, and now you can go across the hall at triple, or maybe you can find another location at a different time in a different place with more time off of work. And I'm very concerned that people are deferring, delaying, or even just skipping care entirely because of these constraints. We are talking to the 2 agencies that are involved here. AG, obviously, who was helping with the transparency bill last year, will probably be brought into this bill. DPH is part of the conversation right now. Also some really terrific conversations with industry. I want to thank both Dave Gross, who's here, as well as my local hospital team back at North Shore Endeavor, who had a terrific meeting with us to talk about this, and would ask leave to move to second, but those conversations do continue.
We have 3 proponents: Ed Peck, Brady and Peck LLC, Keith Mortland from ILHIC, and Lori Reimers from Reimers Consulting. Peck on behalf of Blue Cross Blue Shield, Kate Morthland, Illinois Life and Health Insurance Council, and Lori Reimers, AHIP. And no opponents, and none with no position. Question,
I should be listed as opponent.
I don't have it here. So we have one opponent, Dave Gross from IHA, who will file a slip.
Yep.
And would you like to testify?
Yeah, I'll be quick, Chairwoman. Yes, we've had good discussions with Representative. If you remember, the committee dealt with this last year with Representative West, and we passed legislation, transparency legislation, that notified patients when there would be a facility fee charged. Facility fees are allowed under Medicare. They're allowed by commercial pay. They're a very important revenue source for hospitals. Hospitals have to maintain levels of care 24/7, 365. The fees help subsidize areas of the hospital like the trauma center and the burn center. Those are important services that hospitals provide. We are not in a position to sustain cuts, and that's what this bill would do. This bill would cut revenues to a hospital to the benefit of, you heard the proponents of this legislation, which is the insurance industry. So very concerned about this legislation. Obviously, welcome thoughts from the representative to work with. But again, these are allowed under government pay. They're allowed under commercial pay. Doctor's offices, independent doctor's offices send a bill out. It just says the doctor's fee, right? Medicare requires hospital outpatient centers to have both the fee and the facility fee on there. That facility fee covers the staff nurses, the doctors. It helps subsidize the clinical services there. And we dealt with this last year and reached a good compromise. Obviously open to discussions, but we are very concerned about this legislation, the impact it'll have on the ability for hospitals to maintain 7/24/365 readiness.
Questions? Anyone? Representative, you're asking to pass this out and continue negotiating, or?
That's correct, yep.
Okay.
We're talking to the agency, we're talking to the association. I'd like to keep the possibility of the language as is if that's what we decide on, but we are definitely continuing to talk.
And you'll bring back any amendment to committee?
For sure. If we
Okay.
need to amend, we will be here.
Okay. Can you, we're okay? We're okay? Okay. There being no further debate, Representative Morris moves that House Bill 4701 do pass. Is there leave? Yes. There being, is it 14 or 13? 13 votes in favor, 0 votes opposed, and 0 voting present. House Bill 4701, you're making me so nervous, is declared passed and will favorably reported to the House floor. And the committee, please stay. We're going to stand at ease for a moment, committee. We're just checking on something. Please. I know you're hungry. Don't leave me. That was a lot of drama. We went out on leave, all of us.
Yeah, I didn't hear the amendment get adopted at all.
I said, in the opinion of the chair, the ayes have it, and ended the adoption. It's not a vote, it's a voice vote that I,
Sorry, I didn't hear it at all. I didn't hear anything about the amendment, that's why I asked.
We're confirming with Cal
Okay,
just to make
okay.
sure we're good. At worst, it just means we're rereading the